topic for all of you. And first, I would like to define the what is the pollution. The pollution is basically is the introduction of harmful material into the environment, and these harmful material are called the pollutants. So this is the definition of the pollutants. Now, pollution is the largest environmental cause of diseases and premature death. And how this pollutant is originated? Industrialization, use of pesticides, nitrogen-based fertilizers, cross residue in agriculture, urbanization, forest fire, desert dust, exposure to improper e-waste disposal. Now, presently in a present scenario, this exposure to improper e-waste disposal is very, very important issue for the environmental point of view, and inadequate waste management have caused debilitating and fatal illnesses, creates harmful living conditions. What the effect is? Creates harmful living conditions, intensified environmental health risks and pollution, and destroy the ecosystem. So these are the causes from where this pollutant originate, and what are their final effects. I will go first, or I will go the next slide. If you see the data, the risk of doubling chronic diseases due to this environmental pollutant are about 7 to 90% diseases are probably due to differences in environment. It could be 20%, 20 to 30% could be genetic also. So environment is considered as the body's internal chemical environment. Body में भी chemical environment है, and added on exposure as the amount of biological active chemicals in the internal environment. We have an internal body, internal environment, and also the effect of the added outside effects of these chemicals. So the exposure are chemicals, toxicants entering a body from air, water, and food, and chemicals produced by inflammation, oxidative stress. First of all, these chemicals enter into the body through the air, water, and food, and later their products, chemical produced by inflammation, oxidative stress, lipid peroxidations, infections, gut flora, and other natural process. So this internal chemical environment continually fluctuates during life due to changes in external and internal sources, due to aging, due to infections, lifestyle, stress, and psychological factors, and pre-existing diseases also. Exposure to these agents can be monitored in blood. हम लोग इसको मॉनिटर कर सकते हैं. We can monitor this in blood either by the direct measurement or by looking for their effect on physiological processes such as metabolism. So these processes generate products that serve as a signature and biomarker in blood. So these are the tests for diagnosing what are the toxicants in the body. Either we can measure directly or we can measure their biomarkers or their products. For example, reactive electrophiles, which constitute the largest class of toxic chemicals, cannot generally be measured in the blood, but their metabolites or electrophiles are detectable in serum. The serum is the part of the blood which can be, so metabolites of electrophiles are detectable in the serum, and products of their reaction with blood nucleophiles like serum albumin offer possible signatures, possible indications. Likewise, electrogenic activity could be used to monitor the effect of endocrine disruptors, estrogenic activity, and can be measured through the serum biomarkers. So these, how can we measure, how can we monitor these exposure to these pollutants? The next is, basically, I will give you a basic idea about what are the different types of pollution. Everyone knows there are basically 4 types of pollutions, which are either caused by the natural events like forest fires, or by man-made activities like cars, factories, nuclear waste, etc. So these are the air pollution, water pollution, soil pollution, noise pollution. These are the four categories of the different type of the pollutions. Now, beside these major four categories, there are the four other type of the categories are also like light pollution, thermal pollution, radioactive pollution. Very important. Radioactive pollution is the main cause of the cancers. The latter is much rare than the other types, but it is deadliest. It is the deadliest. This radioactive pollution is rare one, but it is the most dangerous. So we come the first one, air pollution. What is air pollution, and what is the effect of this air pollution on health? Air pollution is a familiar environmental health hazard. Everyone knows. Air pollution is a mixture of the hazardous substances from both human-made and natural sources, such as the vehicle emissions, fuel oils, and natural gas to heat homes, or byproducts of the manufacturing and power generation, and smoke from wild respectively. So they are how the air pollution is created, how air pollution is formed. So these are the various ways through the vehicle emissions, fuel oils, natural gas to heat the homes like in cold areas, byproducts of manufacturing and power generation, and smoke from the wildfires respectively. Now, TRAP is traffic related air pollution. A mixture of gases. What is TRAP? It is a mixture of gases and particles. Ground level ozones, various form of the carbons, nitrogen oxides, sulfur oxides, volatile organic compounds, and polycyclic aromatic hydrocarbons, and fine particulate matter such as the sulfate, nitrate, carbon, and minerals. So these are the mixture. TRAP is basically traffic related air pollution is basically a mixture of gases and particles. It is nothing, is a mixture of gases and particles. Gases are nitrogen oxide, carbon dioxide, carbon dioxide, sulfur oxide. So these are the gases and fine particles, particularly such as sulfate, nitrate, carbons, and minerals. Now, many studies have established that short-term exposure to higher level of the outdoor air pollution. This is the outdoor. TRAP is a outdoor pollution, is associated with the reduced lung function. जो नॉर्मल लंग फंक्शन है उसको ये रिड्यूस करता है. एस्मा होता है. एस्मा इज बेसिकली शॉर्टनेस ऑफ ब्रेथ एंड कार्डियक प्रॉब्लम्स, हार्ट प्रॉब्लम्स. इमरजेंसी डिपार्टमेंट विजिट्स. The people who are exposed to this exposure, outside exposures, they frequently visit the emergency department for the many small problems like shortness of breath, difficulty in breathing, palpitation, and also. So hospital admission and hospital admissions. Mortality rates related to air pollution is also a concern. Exposure to the air pollutant particulate matter of 2.5 is associated with an increased risk of death. Now, PM 2.5 from coal is high in sulfur dioxide, black carbons, and metal. Particulate matter hai, if they are of 2.5 from the coal, is they are rich of sulfur dioxide, black carbons, and metals. Now, air pollution is associated with the oxidative stress and inflammation in human cells. Any reaction, any foreign body, anything, body react in a form of the inflammation. So air pollution exposure is associated with oxidative stress and inflammation in human cells, which may lay foundation for chronic diseases and cancers. Now, what is the effect of this air pollution on cardiovascular diseases? Cardiovascular means in these diseases, the heart and the vessels are involved. So fine particulate matter can impair the blood vessels function. जो अभी हमने आपको particles बताए थे इससे पहली slide में, they can impair the blood vessel function and speed up the calcification in arteries. What happens when there is a calcification in arteries? The arteries become resistant to dilate or to constrict. So there is if there is a constriction and there is a restriction or resistance to dilatation is leads to the raised blood pressure. So exposure to the traffic related air pollution can result in lower level of the high density lipoprotein. This is the lipoprotein of the useful means. This is better. This is considered as the better lipoprotein. The high density lipoprotein is considered as the better. So what this trap done? The trap is lowering the level of the high density lipoprotein, sometimes called the good cholesterol. This high density lipoprotein is also called the good cholesterol. So effect of the trap is this decreases the good cholesterol and increasing the risk for the cardiovascular diseases. So then the effect of this is calcification in arteries and is lowering the good cholesterol in the blood. Now, what is the effect of air pollution on pregnancy? Now, traffic related air pollution exposure also increases a pregnant woman's risk for dangerous changes in the blood pressure, known as the hypertensive disorder of pregnancy. This is known as hypertensive disorder of pregnancy, which are a leading cause of preterm birth. Birth before time. Preterm is the birth before time. Low birth weight. The weight is low than normal of the baby birth. And the maternal fetal illnesses and death. If there is a more toxicity, then it may lead to the maternal and fetal death and illnesses and death. Now, exposure to lead, arsenic, and cadmium. These are the heavy metals. These three are the lead, arsenic, cadmium are the heavy metals. So exposure to the lead, arsenic, cadmium before or during pregnancy might increase the risk of miscarriage. Miscarriage is basically abortion, stillbirth, and birth defects. Birth defect, there may be defect in the limbs, like maybe there may be loss of the digits, maybe deficiency of some part of the nose, or there may be clefts. So these are the birth defects. And lead and other heavy metal can also enter the breast milk, and then through the breast milk it may reaches to the child and harms the child brain development. So this is dangerous, is very dangerous for the pregnant female. Now, mercury pollution is pollution caused by the release of mercury from the mercury product or emission from the coal burning power plants in the air. Coal burning power plants है जहां पे coal use हो रहा है. Like we have a nearby Aligarh is a Kasimpur powerhouse where the coal is burning for production of the electricity. So emission from the coal burning power plants in the air, water and land. Now mercury pollution. So this mercury from the mercury product or emission from the coal, it may goes into the air, it may go into the water or land. So it polluted all three, air, water and land. So mercury pollution results in neurological and behavioral disorder in humans. Neurological in the form of insomnia, means disturbed sleep, loss of sleep, memory loss, headache. Headache is pain in the head, and tremor. Tremor are the abnormal movements, abnormal fine movements over the limbs or the fingers are some of the symptoms of the mercury pollution. So how dangerous is this? Mercury pollution is leads to the mercury pollution gives to the over the prolonged exposure is give rise to the insomnia, loss of sleep, disturbed sleep, memory loss, headache, tremors, abnormal movements are some of the symptoms of the mercury pollution. Now, this is also the case for minerals such as manganese, selenium, and copper. These are the minerals which is sufficient doses are important for normal fetal brain development. These three, manganese, selenium, copper, in a sufficient dose are important for a normal fetal brain development. while levels that are too low or too high can potentially be harmful. These minerals can be also be harmful if they are in the too or high doses. I'm audible to all of you?
Yes, sir.
Yes, sir.
Yes, sir.
Yes,
Yes,
sir.
sir.
Yes, sir. Yes, sir.
Is it clear? Is it
Yes,
clear?
sir. Yes, sir.
Yes,
Yes,
sir.
sir.
Okay. Okay.
Very clear,
Okay.
sir.
Okay.
Yes, sir.
Now, breathing particulate matter of 2.5, as I have earlier said, even at relatively low level, may alter the size of the child's developing brain, which may ultimately increase the risk for cognitive and emotional problem later in adolescence. So what will be the effect of this in adults? First, it will affect the child developing brain, and later in adult's life, it will give rise to the cognitive and emotional problem in the adolescence. Now, prenatal PM 2.5. Now, the first point we were talking about the after birth, है ना? When he is taking the breathing air with the PM 2.5. Now, I'm talking about the prenatal. Prenatal PM exposure was associated with the increased risk of the cerebral palsy. Cerebral palsy is basically a disease which is found in the children when there is a development of brain is affected. In this cerebral palsy, the children has a less IQ and they have a abnormal body movements. They have a less concentrating power. They are hyperactive children. So these are the the features of the cerebral palsy. Now, prenatal exposure to the PAH, polycyclic aromatic hydrocarbon, they are found in the many foods, many preservatives. Polycyclic aromatic hydrocarbons was associated with the brain development effects, slower processing speed, attention deficit and hyperactivity disorder. This is known as the ADHD symptoms and other neurobehavioral problem in the urban youth. So prenatal exposure to air pollution. So prenatal exposure to air pollution may play a role in development of the ADHD related behavior problem in children. Now, prenatal exposure to the particulate matter was associated with a lower weight also. Women exposed to the high level of the fine particulate matter during pregnancy, particularly in the third trimester. Basically pregnancy is divided in 3 trimesters. First trimester, first 3 months, second trimester, next 3 months, and the last trimester is the last trimester is third trimester, which is the last 3 months. So when women exposed to the high level of the particulate matter during pregnancy, particularly in the third trimester, may have up to twice the risk of having a child with autism. Which has a autism. Again, this is a neurobehavioral problem in children, which is autism. Now, second and third trimester exposure to PM particulate matter 2.5 might increase the chances of those children having high blood pressure in early life. The present scenario, the doctors are getting the high blood pressure in children, the age of 20, age of 18, just because they must have been exposed to this air which has a PM 2.5. So this is found in the research that the second and third trimester exposure to the PM 2.5 might increase the chances of those children having high blood pressure in early life. A large study of more than 3 lakh women found long-term exposure to air pollution, especially ozone and PM 2.5 during and after pregnancy increase the risk of postpartum depression. During and after pregnancy increase the risk of postpartum, मतलब after delivery. इन लेडीज में, इन विमेन में पोस्टपार्टम डिप्रेशन बहुत ज्यादा पाया गया. ठीक है. A large study of more than 3 lakhs women found long-term exposure to air pollution, especially ozone and PM 2.5 during and after pregnancy, increase the risk of the postpartum. Partum is basically is related to the delivery. postpartum depression. The researchers found that the exposure to high level of wildfire particulate matter during any period of pregnancy was associated with a greater chance of the preterm birth. Preterm, before time, less in weight, low birth weight. They are associated, that pregnancies are associated with the greater chances of preterm birth, low weight birth. Now, autism is characterized by social and behavioral impairments. Autism, what is autism? It is characterized by social and behavioral impairments that stop mental development at different ages and may be triggered by the environmental exposure during pregnancy. So how dangerous is this air pollution is affecting almost everything. They are causing the many diseases. It affects every system of the body. Now, pregnant women living in the polluted area can be mitigated, or they can prevent the harmful effect of air pollution by taking some precaution. Number one is avoiding going outdoors as much as possible, wearing the face mask. Number three, using air filters and planting trees and air purifying plants around themselves. Lead and other heavy metals can alter men hormones and affect sperm health, reducing fertility also. Now, what is the effects of this air pollution on respiratory disease? What is the effect on lungs? That leads to this, that give that air pollution on the lungs if affecting, this gives rise to respiratory diseases. Now, air pollution can affect lung development and is implicated in development of emphysema. Emphysema is basically the lung cells dilatation, asthma, shortness of breath, and other respiratory diseases such as the chronic obstructive pulmonary disease. There is basically constrictions of in the respiratory system, in the lower respiratory system, that gives rise to the chronic pulmonary diseases, chronic obstructive pulmonary diseases, COPD. Now, increase in asthma prevalence and severity are linked to urbanization and outdoor air pollution. Very important. Increase in asthma prevalence and severity are linked to the urbanization and outdoor pollution. So nowadays, because of the increase in traffic, there is more and more people are suffering with the asthma. Now, shortness of breath. Everyone has the shortness of breath. You go about half a kilometer, you will feel that I'm not feeling well, and some shortness of breath is there. And the children living in a low-income urban areas tend to have more asthma cases than others. In low-income urban areas. Now, long exposure to the PM 2.5, PM 10, and nitrogen dioxide were linked to the chronic bronchitis. Chronic bronchitis. The patient always complaining about the shortness of breath, cough, dizziness, and the wheezing. This is the chronic bronchitis. Productive cough. Chronic bronchitis patient also has the productive cough also. Now, what is the effect on the effect of air pollution on the eyes? Now, particulate matter, nitrogen oxide, and carbon dioxide are mainly generated from vehicle emissions, trap, and fuel consumption are the main material causing outdoor air pollution. Exposure to polluted outdoor air has been proven to be harmful to the human eyes, like in the form of conjunctivitis, redness of the eye, conjunctivitis, itching of the eyes, stye formation, small stye formation over the eyelids, margin of the eyelids. So these are the eye problems. Heaviness of the eyes, redness of the eye, itching of the eyes, and styes over the margin of the eyelids. They all are the eye problems which are because of the air pollution, because of the particulate matter, because of the nitrogen oxides and carbon dioxide in the air. On the other hand, indoor air pollution from the environmental tobacco smoking, heating, cooking, or poor indoor ventilation are also related to several eye diseases, including conjunctivitis, glaucoma, cataract. These are the glaucoma and cataract result after a chronic exposure, over the chronic exposure. and age-related macular degeneration, AMD, age-related macular degeneration. But it is their frequency increases if they are the people are exposed to this type of the air pollution, air pollutants. Now, what is the effect of this air pollutant on the cells? Like the cancer, occupational exposure to the benzene, an industrial chemical, and a component of gasoline can cause leukemia. Leukemia is basically the cancer of the blood forming cells. And this leukemia, the white cells are involved. There is no involvement of the red cells, only the white cells. White cells and the red cells are the components of the blood. So leukemia is the blood forming cells, the cancer of the blood forming cells, mainly the white cells, and associated with is also associated with the non-Hodgkin lymphoma. It is also a cancer of the lymphatic system. Basically, it is a cancer of the lymphatic system. So long exposure to the PM 2.5 and nitrogen dioxide increase the risk of the colorectal and prostate cancers. These two, they increase the colorectal. Colo is the large intestine. We have in our body, we have the small intestine and large intestine. And this colorectal area is basically is for storing the fecal matter. So long exposure to the PM 2.5 and NO2 increase the risk of the colorectal and prostate cancer. Prostate is basically cancer of male. It is a cancer of male. Prostate is a small gland which lies at just the first part of the urethra in male, around the urethra of male. When it increases, it is known as the prostatitis or BPH, benign prostate hypertrophy. And this also can give rise to the prolonged exposure, may give rise to the prostate cancers also. Women found living near the major roadways may increase a women's risk for breast cancers. The breast cancer most often affects women under 50 and caused by genetic, hormonal, environmental factors. Cancer is caused by uncontrolled cell growth. What is cancer? Basically, cancer is nothing but is a abnormal cell growth. In our body, we have a controlled cell growth, cell division. When this cell division is uncontrolled, this will give rise to the cancer. So cancer is caused by uncontrolled cell growth and can affect people of all ages, with half of the cancer death being people not yet born. Environmental factors play a role in many diseases. Now, this is a new research. 8 new substances has been identified as carcinogens in the latest 15th report of the carcinogen released by the US Department of Health and Human Services on December 21, 2021. Now, chronic infection with Helicobacter pylori has been listed in the category of the known to be a human carcinogen. This is basically is a very dangerous thing. Helicobacter pylori. It is basically known to be a human carcinogen. The remaining 7 are listed in the category of reasonably anticipated to be a human carcinogen. These includes antimony trioxide and 6 haloacetic acids. Antimony trioxide and 6 haloacetic acids. These are the bromochloroacetic acid, bromodichloroacetic acid, chloro-dibromoacetic acid, dibromoacetic acid, dichloroacetic acid, and tribromoacetic acid. So 6 haloacetic acids and antimony trioxide. Along with this, these are the remaining. These are the 7, and this Helicobacter pylori has been identified as the 8 new substances, which is identified as the carcinogens, then give rise to the cancers in human beings. Now, antimony trioxide is used as a flame retardant in plastics, textiles, and other consumer products. It is an occupational hazard for person engaged in its production or use. Now, dust from wear and tear of the consumer products like the furnitures, carpets that have been treated with the flame retardant may be a potential source of low-level exposure. Low-level exposure of antimony trioxide. Now, haloacetic acids are formed as a byproduct during the process of water disinfection. Haloacetic acids are the byproducts during the process of water disinfections because of the reaction between the organic matter in the water and the chlorine-based disinfectant. So they are the byproduct. Haloacetic acids are byproducts during the process of water disinfections. The report on carcinogens identifies substances which are carcinogenic and therefore may be hazardous to human health. There may be hazardous to the human health. So, however, the report does not establish the exposure condition that pose a cancer hazard to individual in their daily life, nor does it include estimate of risk of cancer. Many factors such as carcinogenic potency of the substance, these are the factors which can be considered in development of the cancer, is counted in development of the cancer. Carcinogenic potency of the substance, level and duration of exposure. Number 2, an individual susceptibility to the carcinogenic action of the substances influence whether a person will develop cancer or not. So these are the factors, 4 factors: carcinogenic potency of the substance, level and duration of exposure, and the individual susceptibility to the carcinogenic action of the substances influence whether a person will develop cancer or not. Now, older adults. In adults, what are the effects of these air pollution is Alzheimer's disease and related dementias are public health challenges for aging populations. Now, ambient air fine particles increase the risk of the dementias. Ambient surrounding. Ambience means आसपास के, आसपास जो आपके आसपास है, जो सराउंडिंग्स है, एटमॉस्फेयर है, जो एयर है, एयर फाइड पार्टिकल इंक्रीज द रिस्क ऑफ द dementias. Now, PM 2.5 from many sources, emission from agriculture, traffic, coal consumption, and wildfires, in particular, were associated with the increased rate of the dementias. In dementia, there is a loss of memory. In dementia, less concentration. People feel isolated. Mainly the memory affected. So the air pollution was linked to the greater chance of developing several neurological disorders, including Parkinson's disease. This is also a disease, old age disease, in which the person has a short steps, छोटे छोटे कदम होते हैं, tremor, walk with the bending posture, है ना? So these are the few symptoms of the Parkinson's disease, Alzheimer's disease, and other dementias. They come with the and other dementias. And all these, there is a basically loss of memory, less of concentration, not remembering the things, talking relevant, all are in dementias. The osteoporosis is basically the weakness or decalcification of a bone, affects women more than men due to the air pollution. Large study associated with the high level of the air pollution with bone damage, particularly in the lumbar spine. Basically, in the spine, in the back, we have a cervical spine, which is an area of the vertebrae or vertebral column, which is in the neck, is known as cervical spine. The area which is over the chest, back of the chest, is known as the thoracic spine, and the area which is back of the abdomen is known as the lumbar spine. So, a large study associated with the high level of the air pollutant with the bone damage, particularly lumbar spine, just above to the pelvis. Among the post-menopausal women, which is more than 45 years old, don't have any menses. So study found omega-3 fatty acids obtained by the eating certain fish may protect against PM2 associated with brain shrinkage in the older women. So how we can counter this in old age is we take the omega-3 fatty acids which are available in the form of the capsule, which are found in the large quantity in fish. The people they can use the fish in their diet. This omega-3 fatty acid may protect against PM2 associated brain shrinkage. Brain shrinkage means the diseases of the old age or diseases or developing neurology. These are the neurological disorders. So omega-3 fatty acids protect from slowing the neurological disorder in old age. Now, community level tactics and public policies for reducing exposure to RAP using high efficiency particulate air filtration. How can we use the counter this trap is using the high efficiency particulate air filtrations. These are the HEPA filtration, HEPA filtration. Now, second is after completing the air pollution, the second pollution is sound pollution. In general, any sound which is over 85 decibel is considered to be detrimental. अगर कोई भी साउंड 85 डेसिबल से ज्यादा है तो वो नुकसानदेह है ह्यूमन बॉडी के लिए. Also, the duration an individual is exposed play an impact on their health. For perspective, in normal conservation is around 80 decibel. I am talking to you. I am talking on around 80. I am in conservation with you is about at a 860 decibel. And a jet taking off and around 150 decibel. Jet जो टेक ऑफ करता है उसकी जो साउंड की जो डेसिबल होती है वो दैट इज अबाउट 150 डेसिबल. Consequently, noise pollution is more obvious than the other type of the pollution. Noise pollution has now become very common due to dense urbanization and industrialization. Noise pollution can bring about adverse effects such as hearing loss, tinnitus. Tinnitus means something is ringing in the ears. Sleeping disorders, the people are not able to sleep. The neighbor is using the high volume sound DJ. So people are disturbing. They are causing disturbing to the people. Their sleep is disturbed. So this leads to the sleeping disorders. If the person does not have the proper sleep, it will affect every output of the patient, every output of the person. He will be irritated. He will be not interested in work. He will give his performance 100% performance. All are the side effects of the sleeping disorders. The sound pollution also gives rise to the high BP. High BP, communication problems. Several studies conducted worldwide have indicated the exposure to the air pollution can increase the risk of autism spectrum disorder in babies. The next is the water pollution and waterborne diseases. This is a very long topic. So, waterborne diseases are illnesses caused by the microscopic organisms like viruses, bacteria that are ingested means taking in food through contaminated water or by coming in contact with the feces. Waterborne diseases are number one, typhoid fever, enteric fever, and the second name is also known as enteric fever, commonly known as the typhoid fever, cholera, giardia, dysentery is a loose motion with blood, Escherichia coli, E. coli infection, hepatitis A infections, and salmonella. These are the different waterborne diseases which are transmitted by ingestion of the contaminated water. Now, other than this major pollution, there are the radioactive pollution. Is the pollution caused by the release of the radioactive substances in the atmosphere during activities such as the nuclear explosions, mining of the radioactive source, etc. The example of the radioactive pollution is the testing of the nuclear weapons on land and water. ये इसका example है. Resulting ionizing radiation pollutes the soil. Soil को pollute करते हैं, water, and even decades after initial testing. So they have a very long effects on the soil, water, and the plants, over the plants. So this type of the radiation can cause damage to the tissue and DNA in genes. This type of radiation, radioactive pollution जो है, this type of radiation can cause damage to the tissue and DNA in the genes. That is genetic mutation that increases and this is they will cause the damage to the genes and the tissue. This is known as the genetic mutation that increases the predisposition to cancers and chronic diseases. If the person is exposed to these radiations, he or she become more predisposes to developing cancers. They are more prone to developing cancer and chronic diseases. Now, what is the effect of the radioactives pollutes or pollutants? Number one is pollution diseases. The most dominant illness linked to the radiation is cancer. Most dominant illness is cancer. Cancer is basically, I have told you, it is basically nothing but as a abnormal division of the cell. It is a abnormal division of the cell. Now, over the years, and why it is abnormal division? Because this radiation, they causes changes in the DNA, in the genes. So over the year, it has grown and poses a great danger to the global health. Others include leukemia. As I've told you, it is a cancer of the blood forming cells and the lymphatics. Anemia. In anemia, there is a less hemoglobin. Hemorrhage, bleeding. Hemorrhage is a bleeding term used for the bleeding. A decline in lifespan leading to the premature aging. Effect of this also decline in the causes decline in the lifespan, leading to premature aging and premature death. Premature aging is the people are nowadays is also experiencing the whitening of the hairs at a very early age because there's some type of the radiation are there in the sun exposure also, and this is also effect of the air pollution, as well as other complications such as cardiovascular diseases. Leukemia is caused in the bone marrow by radiation. Now, number two is effect of radioactive is number two is infertility of the soil. Now, radiation exposure to environment means that it is present even in the soil. Radioactive contaminants in the soil react together with the various nutrients that are present in the soil, and that causes the nutrient to be lost, making the soil highly toxic and infertile. Infertile means there is no any cropping, no crops there. Infertile in the sense. Such soil contribute to the harvesting of crops that are riddled with the radiations and thus unfit for human and animal consumption. The next effects of the radioactive is burn. It is not easy to experience radiation, but it is easy to know that it has shaped you. Evidence is the acute appearance of the burns, red lesions, and sores. This will result in skin cancer to make it worse. How you can if you have been exposed to the radiation, you can notice this in a form of the red lesions and sores. And this finally red lesion, if you are continued in a range of the exposure, this will result in skin cancer to make it worse. Now, radioactive contamination have been shown to alter current cells, resulting in irreversible tissue and organ damage. In circumstances of extreme radiation exposure, permanent sickness and death are common or not uncommon. If you are in a continuous exposure range, then the sickness, chronic sicknesses, chronic illnesses, and the death are the common resultant. As a result, the radioactive pollution is a major hazard to both human life and the ecosystem as a whole. It is for this reason that radioactive waste must be properly disposed of. They must be properly disposed of. Now, what is the effect on plant life? Plants are also exposed to radiation, and much of the damage is caused by the increased ultraviolet waves. Similar plants are differently affected. Differently affected. During the rise in radiation, stomata avoid evaporating. क्लोज हो जाते हैं. जो उसके पोर्स होते हैं लीफ के, स्टोमेटा जो कहलाते हैं, दे अवॉइड एवोपरेटिंग. रिप्रोडक्शन इज हिंडर्ड. उनका रिप्रोडक्शन हिंडर्ड हो जाता है व्हेन द रेडिएशन रीचेज द क्रोमोसोम्स in plants is result in altered type, size and health. Now, there are some general facts related to radiation exposure effects. Any amount of radiation may cause cancer. Any amount, especially in sensitive individual. Or, in other words, any exposure to radiation may cause some risk. Thus, it is always safer to minimize as much as possible the exposure to radiation. Number 2, cancer due to radiation exposure at lower doses usually develop years after the actual exposure. Cancer due to radiation exposure at a lower dose usually develop years after the actual exposure. While the risk of developing cancer increases with the dose of radiation. अगर आप रेडिएशन की डोज बढ़ा देंगे तो कैंसर के चांसेस बढ़ जाएंगे. Risk may vary greatly between the individual, and it is also, as I've told you, it depends on the individual also, and it also depends on the dose and period of exposure. Now, lung cancer is a typical example of the effect of exposure to radon. Lung cancer is a typical example of effect of the exposure to radon, which is second leading cause of the lung cancer in America. Now, this risk of the lung cancer also increases with the smoking. Now, second is thyroid tumors. Thyroid gland होती है neck में, उसके tumors होते हैं, उसके cancer होते हैं, may also develop due to effect of the radioactive iodine that accumulate in the thyroid. So, the people who are living in the range of the radiated area, radioactive area, to counter this radioactive iodine, iodine is basically giving in their diet. Iodinated salt is giving their diet, so they have a less effect of the radioactive iodine. The hypothyroidism may also be an effect of radiation caused by the destruction of the thyroid gland by accumulated radioactive iodine. Hypothyroidism. In hypothyroidism, mainly people are lethargy, obese, they always have some pain in their body. They may have the swelling over the body. So these are the symptoms of the hypothyroidism. Now, skin cancer may also develop as a result of the prolonged ultraviolet exposures. skin cancer may also develop as a result of the prolonged ultraviolet exposure. Exposure to low amount of radiation over long period of time give rise to the mutation. Now, thus genetic birth defects and retardation are possible due to parents' exposure. Other health problems may develop affecting the neurological, reproductive, or cardiac system. And these may or not be followed by cancer. So these are the exposure to low amount of radiation over prolonged of time is give rise to the effect on the may have an effect on genetic materials. If they have the effect on genetic material, this ultimately give rise to the mutation. And this mutation finally comes in the form of genetic birth defect and retardation. It may also have an effect on the other health problems, like the neurological problems, like reproductive problems or cardiac systems. And it may not be followed by the cancer. So these are about the harmful effects of the different types of pollutes or pollutants. Now, what is the concept of the health? Now, health is evolved over the centuries as a concept from individual concern to worldwide social goal and encompasses the whole quality of life. Changing concept of the health till now are biomedical concept of health, ecological concept of the health, psychological, psychosocial concept, and holistic concept of health. Now, what is the biomedical concept of health? Traditionally, health has been viewed as an absence of disease. Health हम लोग कब कहते हैं? When there is no disease in the human body, then we call as you are a healthy person, I am a healthy person. If one has free from disease, then the person was considered healthy. This concept has the basics in the germ theory of diseases. Now, medical profession viewed the human body as a machine, disease as a consequence of the breakdown of machine, and one of the doctor's tasks as a repair of the machine. So in medical profession, human body is a machine, disease is as a result of consequences of the breakdown of the machine, and one of the doctor's tasks as a repair of the machine. Now, ecological concept. From the ecological point of view, health is viewed as dynamic equilibrium between the human beings and environment, and disease as a maladjustment of human organs to the environment. Ecological concept raises two issues: imperfect man and imperfect environment. Psychosocial concept. According to the psychosocial concept, the health is not only biomedical phenomena, but it is influenced by the social, psychological, cultural, economic, and political factor of the people concerned. So, according to the psychosocial concept, health is not only biomedical phenomena, but it is influenced by the social, psychological, cultural, economic, and political factor of the people concerned. If you see holistic approach, have a holistic concept, this is synthesis of all the above concepts. Holistic is, as the name indicates, this is the synthesis of all the above concepts. It recognizes the strength of social, economic, political, and environmental influences of health. Holistic concept क्या करता है? It recognizes the strength of social, economic, political, and environmental influence on the health. According to the holistic concept, it describes health as a unified or multi-dimensional process involving the well-being of the whole person in context of his environment. The holistic concept describing the health as a unified or multi-dimensional process involving the well-being of the whole person in context of his environment. Now, there's a new philosophy of the health. Health is a fundamental human right. Health is the essence of productive life. Health is intersectoral. Health is integral part of development. Health is central to the quality of life. Health involves the individual's state and the international responsibilities. Health and its maintenance is major social investment. Health is worldwide social goal. These are the new philosophy of the health. The feature of mentally healthy person. If the person is mentally healthy, they must be free from internal conflicts. तब उसे हम मानेंगे they are mentally healthy. Well adjusted in external environment, searches for one's identity, strong sense of self-esteem, knows himself, his mind, problems and goal, having good self-control, controls, balances, faces problems and tries to solve them intellectually. If these all are the features are present, all of the points are present in a person, he is considered to be healthy. Then there is distinction between disease, illness, and sickness. What is the difference in the disease, illness, and sickness? Term disease literally means without uneasiness. When something is wrong with the body function. And illness is referred to the presence of a specific disease and also to the individual's perception and behavior in response to the disease, as well as the impact of that disease on the psychosocial environment. This is illness. What is disease is uneasiness or uneasiness when something happened to the body function is wrong with the body function. Uneasiness hai when something is wrong with the body function. And illness is referred to the presence of specific disease. Disease है plus individual उसका perception क्या है, behavior क्या है, respond to disease, as well as उस disease का impact क्या है उसके psychosocial environment पे. These all three components are the component of the illness. Sickness referred to the state of social dysfunction. Sickness referred to as state of the social dysfunction. Now, two concept of health is subjective. It is formed by the sensations and feeling of a person suffering from disease. Subjective aspects होता है health का. It is formed by the sensations and feeling of a person suffering from disease. Objective is objective. Its basis is formed by the objective parameters obtained by measurement of structures and function of person during disease. Display हो रहा होगा? Okay. Objective is its basis is formed by objective parameters obtained by measurement of the measurements of the structure and function of a person during disease. Now, quality of life can be evaluated by the assessing the person's subjective feeling of the happiness or unhappiness about the various life concern. Now, determinants of health is determined by multiple factors. Health of an individual and community is influenced by the individual internal and external factors. Internal factor includes his own genetic factors, and external factors include environmental factors. These factors, internal and external factors, genetic factors and environmental factors, they interact, and these interaction may be health promoting or deleterious. Thus, the health of the individual and the whole community may be considered to be the result of the many interactions. Biological determinants of health is health of an individual partly depends on genetic constitution. As I told you, this is the internal environment. A number of the diseases like chromosomal abnormality, chromosome की abnormalities हो, anomalies हो, inborn error of metabolism, inborn metabolism many diseases आती हैं, mental retardations, and some type of the diabetes are some extent, and some type of the diabetes are some extent due to genetic origin. Type 1 diabetes are also is genetic in origin. Type 1, when there is no or less production of the insulin. They say type 1, type 2 diabetes is basically there is defect or problem with the action of the insulin. At the site of the receptor site, there is problem with the action of the insulin. Now, biological is disease promoting agents. Example, as I've told you earlier, virus, bacteria, fungi, intermediate hosts, mosquito, sandflies, vectors, housefly, reservoirs, pig in Japanese encephalitis. They all are the biological environmental factors. Physical are air, water, light, noise, soil, climate, altitude, radiations, radiation housing, and waste. Psychosocials are makeup of individual and structures and function of the society. This is the wave of disease causation. This is the wave of disease causation. Change in lifestyle give rise to lack of physical exercises. Plenty of food intake, changes in lifestyle hoga. This will give rise to the obesity. Obesity give rise to the hyperlipidemia, and hyperlipidemia, bad cholesterol, and this bad cholesterol give rise to the coronary diseases, coronary atherosclerosis, and this coronary artery disease give rise to affect the coronary circulation. Coronary circulation is the circulation of the heart, and this guy, if there is a compromise or decrease circulation, then give rise to the myocardial ischemia. Some part of the heart may have a deficient blood supply. Because of the deficient blood supply, become necrosed or dead, and this guy will give rise to the myocardial infarctions. As maybe changes in lifestyle like the smoking, stress. In stress, the people are using smoking, they are doing smoking, and emotional stress. This give rise to the hypertension. Aging give rise to the hypertension. Obesity give rise to the hypertension. Smoking also affect the coronary circulation, and all these later on, this changes in the walls of the arteries. Stress, aging, smoking, cholesterol, they causes the changes in the wall of the arteries, and this change in wall of the arteries give rise to they will affect the coronary circulation of the heart, and this give rise to the myocardial infarctions. So this is the wave of a disease. In this is shown, we have shown how this will affect a particular disease. Lifestyle is basically behavioral pattern and lifelong habits. Smoking, alcohol consumption, food habits, personal hygiene, rest, physical exercises, bowel and sleeping patterns, sexual behaviors, all these comes in the lifestyles. Now then the next step, come the prevention of diseases. Now activities designed to protect patients and other members of the public from actual or potential health threats and their harmful consequences. This is the definition of prevention. These activities, disease prevention is activities designed to protect patients and other members of the public from actual or potential health threats and their harmful consequences. Now prevention action aimed at eradicating, हमारा मेन जो एम होता है प्रिवेंशन का, एक्शन aimed at the eradicating, eliminating or minimizing the impact of disease and disability, or if none of these is feasible, retarding the progress of disease and disability. In most of the chronic diseases, this is the main aim of treatment. Prevention. In few diseases, we can do the prevention, and few we can do the cure also. So prevention better than cure. So prevention action is eradicating, eliminating, or minimizing the impact of disease and disability, or if none of these is feasible, retarding the progress of disease and disability. The concept of prevention is best defined in the context of the level of prevention, primary, secondary, or tertiary prevention. Now, primordial prevention is prevention of emergence or development of risk factor in countries or population groups in which they have not yet appeared. Primordial is the prevention of emergency or development of risk factors in countries or population groups in which they have not yet appeared. What we do in the primordial prevention, intervention in individual or mass education. इंडिविजुअल और मास एजुकेशन. क्या करेंगे इसमें हम? इंटरवेंशन इंडिविजुअल और मास एजुकेशन करेंगे. एग्जाम्पल, नेशनल प्रोग्राम्स एंड पॉलिसीज ऑन फूड एंड न्यूट्रिशन, नेशनल पॉलिसीज ऑन अगेंस्ट स्मोकिंग एंड ड्रग्स, नेशनल पॉलिसीज टू प्रमोट रेगुलर फिजिकल एक्सरसाइजेस. These are the primordial prevention. Primary prevention is action taken prior to onset of disease, which remove the possibility that the disease will ever occur. Now, intervention, primary prevention is pre-pathogenesis stage of disease, and mode of intervention is health promotion and specific protection. Mode of intervention is health promotion and specific protection. Now, secondary prevention is action which halt the progress of disease. Secondary prevention क्या है? The action which halt the progress of disease at its incipient stage and prevent complications. Intervention at which level? Early pathogenesis stage. Mode of intervention, early diagnosis and adequate prompt treatment. Early diagnosis and treatment is the mode of intervention in secondary prevention. Definition क्या थी? Action which halt the progress of disease at its incipient stage and very initial stage and prevent complications. Now, tertiary prevention is all measures available to reduce or limit impairments and disabilities and minimize suffering caused by existing departure from good health, and to promote the patient's adjustment to irremediable condition. The mode of intervention is disability limitation and rehabilitation. Disability limitation and rehabilitation. That was disease prevention. Now, disease control is reducing the transmission of disease agent. Disease control क्या चीज है? This is definition. By definition is that reducing the transmission of disease agent a low level that it ceases to be a public health problem. It describes operations aimed at reducing the incidence of disease, duration of disease, and consequently the risk of the transmission, effect of infection, including both the physical and psychosocial complications, the financial burden of the community. And main मकसद disease control का है the incidence कम करना disease की, duration of disease कम करना, effect of infection both physical and psychosocial complication कम करना, and financial burden of the community, to reduce the financial burden of the community. Disease control involved controlling the reservoir, interruption of the transmission, susceptible host. Controlling the reservoir हम कैसे करेंगे? Early diagnosis, जल्दी से हमें पता लग जाए, जल्दी से डायग्नोज कर लें, नोटिफिकेशन कर दें उसका, एपिडोलॉजिकल इन्वेस्टिगेशन कर दें, घर टू हाउस आइसोलेट कर दें इफेक्टेड पर्संस को एंड क्वारंटाइन. Interruption of the transmission, and the third stage of this disease control involves susceptible host. We do the active immunization, passive immunization through susceptible host, combined passive and active immunization, chemoprophylaxis. Chemoprophylaxis is given by medicine or non-specific measurement. Non-specific measurement by precautions, taking precautions. Notification: once an infectious disease has been detected or suspected, it should be notified to the local health authority. Disease under surveillance by WHO nowadays is polio, viral influenza A virus, smallpox, malaria, relapsing fevers. These are all the diseases which are under surveillance by the WHO. Disease under international health regulation are cholera, plague, and the yellow fever. They are under international health regulation. Now, this is the definition of the control elimination of disease. Disease incidence is reduced to minimum level. Control is elimination is the reduction to zero of incidence of a specific disease in identified community or country region as a result public health action. Eradication is, it means worldwide disappearance of a disease is known as eradication. Means that is permanent reduction to zero level. The organism may be present only in laboratories, but there is no need for public health actions. Like smallpox since 1979. Smallpox is no more worldwide, but it is present in the laboratories. The cycle of the infections and intervention applied at each link. I have already discussed this. These are the different cycles of the infection where we can act in a different way. Now, these are the measures toward the reservoirs. The objective control measure toward the reservoir is reduce quantity of the agent or reduce communicability. दो objective हैं. How? Measures by taking measure toward the cases, by taking the measure toward the carrier and measure toward the animal reservoir. Now, measure toward the cases is case findings, reporting, segregation and isolation of cases, treatment of cases, disinfections. Now, measure towards the cases are also segregation and isolation of cases. This means that the patient is isolated from the community in a fashion that prevents direct or indirect spread of the infection agents. Isolation is usually done for a period which equals the period of communicability. At a hospital or at a home, ideally repeated negative samples are needed before this release. Every disease has a period of communicability, so isolation is done till every disease have a definite period of till the of that disease's period of communicability. Treatment of cases, early diagnosis and prompt treatment of the infection with appropriate regime like antibiotic, antiviral, or other chemotherapeutic agents help reducing communicability. Disinfections, concurrent or terminal, Disinfection of the soiled articles by the patient, discharges or excreta concurrently during his presence or source of infection help in reducing of the communicability. Soiled articles by the patient, used by the patients. Disinfection of the contaminated objects with appropriate enteric precautions, respiratory precautions, universal precautions. Measures apply to carriers. Detection of carriers if they present important reservoir infections, if they were suspected in a close community such as boarding schools, army barracks, food handling places, etc. Exclusion from work in certain occupations, for example, food handlers or teachers. Treatment for the carrier's state. Measure apply to animal reservoir in inspection and slaughtering of the infected animal. Testing and immunization of the uninfected sheep, cattle. Careful husbandry and sterilization of animal products. Destruction of animal reservoirs have been successful with the disease such as the rabies and the bovine TB. Susceptible host, measure to susceptible hosts is surveillance, observation, quarantine, increasing resistance of susceptibles. Surveillance means close medical supervision of the contacts without restricting their movement for the purpose of early detection of the disease in question. Surveillance should be done for duration of longest incubation period of the disease counted from the date of the last exposure. So in surveillance, we do not restrict the movement of the diseased person. Quarantine means separation with restriction of the movement in a specific place of apparently well person, animal who have been exposed to a case of infection diseases. Quarantine. अभी क्वारंटाइन COVID-19 में we are using the term quarantine. Quarantine is done for the duration of longest incubation period of the disease counted from the date of last exposure. Now, how we can improve the defense mechanism of the host by using chemoprophylaxis, seroprophylaxis, immunization. Chemoprophylaxis, administration of the chemical including antimicrobials to prevent the development and to slow the progression of disease to active clinically manifest disease. Chemoprophylaxis is also used for travelers to endemic areas and occupationally exposed persons. Examples: INH for contact of tuberculosis cases, rifampicin for contact of meningococcal meningitis, chloroquine for traveler to malaria areas, seroprophylaxis is antibodies, ready-made antibodies, also known as the passive immunization. Examine immunoglobulins and tetanus and ATS, tetanus anti-tetanic serum. That is a example of we are taking in case of there is a injury by the rusted iron. So we give the seroprophylaxis. They are the basically ready-made antibodies for passive immunization. Tetanus anti-tetanic serum. In case of measles, if it is given within the first 3 days of incubation period, it prevents the attack and giving immunity for 4 to 5 weeks. If you are administered from 4 to 10 days of the IP incubation period, the subject gets a modified attack and permanent immunity. So, finally, I would like to end my lecture. Prevention. So, rehabilitation is a measure to train disabled individual to reach the highest level of functional ability by using combined coordinated medical, social, vocational, psychological, and educational measures. Rehabilitation includes the medical rehabilitation, educational rehabilitation, vocational, social rehabilitation, and psychosocial. So that's all of my lecture today.
Sir, thank you. Actually, I have a question. Can I ask you?
Yeah, please.
Sir, this is Milon Mondal from West Bengal. Actually, in your lecture, during when you were discussing about the kind of cancer, various types of cancer and its causes, you actually used a term that individual susceptibility to carcinogenic material. So,
Yeah.
what is meant by that, sir? Could you please clarify that?
Individual susceptibility means some people are very prone to the low doses of the radiation, and some people are very resistant. They are not developing the cancer like the people. I will give you example, a common example. Some people are. Hello.
Yes, sir. Please
Hello.
continue. Sir, please continue.
Someone is speaking behind this. Please. So I'm just for understanding. If you see the most of the very chronic people are using the tobacco, है the about if suppose 100 people we consider the in a study 100 people are using tobacco, chewing tobacco, but all are not developing the cancer. Only few are developing the cancer. Their habit, their exposure, their susceptibility all depends on the how the cancer is developed. Many people they are chronic tobacco chewers, but they are not developing the cancer. And the few which are taking which are taking the very small and for a very short period, they are developing the cancer. So the cancer is basically is depend also genetic composition also. I thought it will be clear to you now.
Yes, sir. Actually, how can it be possible to understand who is more susceptible and who is less?
Basically it is depend on uh, the the family history also. Genetic composition.
Yeah,
It will depend on the genetic composition.
Okay,
it is a very big topic. It will depend on the genetic composition also of the person.
Sir, again, I think if a person suppose in a family a person actually died from cancer and he was the first victim of cancer in that family. So how far is it believable that it's genetic actually?
I am telling you the cancer of the cervix in female. The cervix cancer in female if there is it is the female in a family has a 2 or 3 female in a family, there are more chances of doubling the cancer in the coming few generation.
Thank you very much, sir.
Okay, thank you very much, sir.
I would like to also ask a question. First of all, thank you very much for the wonderful and fruitful session which has been delivered by you. Sir, मेरा ये question था. First time I have listened the various type of the health as economical, biological, physical, etc. etc. तो पहले बार हम लोग केवल बायोलॉजिकल हेल्थ के बारे में जानते थे कि अगर हम सफर कर रहे हैं कोई डिजीज से, हम फिट नहीं है तो हमारा बायोलॉजिकल हेल्थ इफेक्टिव होता है. लेकिन सर आप द्वारा इतने डिफरेंट टाइप ऑफ द हेल्थ इशू को समझकर आज रियल में जाना कि हेल्थ होता क्या है,
Thank you.
कितने तरह से होता है। तो सर एज ए बीइंग द टीचर, वी ऑल आर द टीचर हियर, तो एज ए बीइंग द टीचर हमको हर तरह से फिट होना पड़ता है, तभी कहा जाता है हम एक अच्छा लेक्चर डिलीवर कर सकते हैं। तो हम सभी टीचर को सर सभी हेल्थ को कैसे प्रॉपर वे में मैनेज करें, बिकॉज सर यू आर मोर सीनियर देन अस, तो सर आप कैसे सभी चीजों को मैनेज, क्योंकि आप एक्सपर्टाइज भी है आपका इसमें, आप गुड टीचर भी हैं, आप अच्छा डिलीवर भी करते हैं, तो सर हम क्या करें जिससे हम अपने आप को हर तरह से फिट रखें, हेल्दी रहें हर तरह से सभी हेल्थ इशू को लेकर, और अच्छा लेक्चर डिलीवर कर सके अपने स्टूडेंट के बीच।
देखिए, two or three main things are basically you do the physical exercises. You take a proper diet, avoid the junk foods, avoid you change your lifestyle, avoid you must have the 7 hours of sleep. Okay, the diet should be complete. It must have the fruits, it must have the rice, it must have the pulses, everything balanced diet. And physical exercise is one of the important factor also. Okay, and if you are more conscious about your health, then you do the more thing also, like the screening of your physical fitness every 3 months. So if there is any thing is going wrong in your body, you can detect at a very early stage and bring your life, you do the lifestyle changes. Lifestyle changes mean you do the exercises, you take the proper meal, and avoid outside meal. You if you are living in a air polluted area, you take the mask, you take the small precautions, take the 7 hours sleep must. If you are diabetic, you are hypertensive, you take the medicine at proper time. So all these are the measures you are supposed to do the this social for the social health. Social health, you try to adjust in the society, and you make your friend circles with the society. You share your happiness, your grievings, your problems with the society. And mental, as I've told you, if you are taking sleep of 7 hours, then it's okay. 7 to 8 hours is very good for your health, mental health. And avoid the stresses. Try to be happy in whatever you have, and thank God for every breathing you are taking. है ना, ये हर सांस में खुदा का शुक्र अदा करिए, जो कुछ है बेहतर है, उसका शुक्र एहसान है। अपने आगे पीछे देखते रहिएगा, आपसे बुरे भी लोग हैं, आपसे अच्छे भी लोग हैं, डोंट वरी। ओके, so these are the few points for keeping yourself happy and healthy. Thank you
very much sir। यहाँ मैं कहना चाहूंगा सर, मेरा एक फ्रेंड रहा सर, उसने सिख गवर्नमेंट जॉब क्वालिफाई किए विद इन ए शॉर्ट टाइम, वो सभी चीजों को मैनेज किया, लेकिन वो अपने फैमिली लाइफ मैनेज नहीं कर पाया। There was more problem with her. He need a psychological counselor. Yes sir। है ना, उसकी टीचिंग सर अच्छी नहीं रह पाई, मैंने देखा, बिकॉज ही वो साइकोलॉजिकल काउंसलर के पास जाए, उससे वो इंटरेक्शन, उनके मीटिंग करेंगे, उसके बाद सही हो जाएगी प्रॉब्लम। ओके, थैंक यू वेरी मच।
Good morning, sir. This is Avinash from Mau. Sir, I want to be clear about control and eliminated disease. Sir, COVID is now control or eliminated disease in India?
It is not controlled now. Not limited, not controlled. Even the very different variant of the COVID is coming nowadays. Day by day, they are a variant of the COVID is coming. Neither it is controlled, not eradicated.
So then, sir, what are criteria for eliminated disease, sir?
I tell you the definition of that, na? The criteria. At least where there is no for eradication, there is no any case for at least for 5 years. Then you will say that there is no COVID, and COVID has eradicated completely.
Okay, sir. That means COVID is neither controlled or nor eliminated now.
Arshad Saab, Dr. Arshad Saab, are you here? Hello. I would like to end this lecture because I have some meeting. Please.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you so much, sir. Thank you, sir.
Thank you, sir.
Thank you, sir. Thank you, sir.
Thank you so much.
Thank you, sir.
Welcome, welcome. All of you are welcome. All of you are welcome.
Thank you, sir. Thank you, sir. Thank you, sir.
Thank you very much,
Thank
sir.
you, sir.
Thank you very much.
Thank you.
बुला लो यार.